For those who tune for the first time, I'm Dr. Francisco. I am a specialist nephrologist and a transplant immunologist working at Francisco Kidney Medical Center in Singapore. Welcome to the bite-sized information for kidney and related diseases. This video blog is destined to help patients with kidney problems or at risk of kidney problems or their relatives to be better informed so they can take better control of their disease, minimizing worries and complications. Today, we are going to discuss a very common issue that is pain during dialysis, but also a very common worry of people who are considering hemodialysis. So first of all, I need to say once more, as I always say, that every patient is different. So everyone has got different sensitivity to pain. Many patients indeed can experience pain in the needling process if they have an arteriovenous fistula or a vascular graft as vascular dialysis access. But some topical creams, the so-called EMLA, containing analgesic, that is a painkiller, are used to numb the surface area to be needled. They're used before the needling process to minimize pain while the needle is going through and piercing the skin. But as I mentioned, on the other hand, there are patients who say that they have no pain during the needling. Pain is very individualized. But do tell your dialysis nurse or your doctor if you're having so much pain while needling. They could use such a cream or do anything else that can help you. Occasionally, it can be due to the technique used during needling. I have heard patients that say that they feel less pain when a different nurse needles them. Do not feel afraid to ask your dialysis team to, if you would like to try a different nurse. They are very accommodative. They actually are very thoughtful of your comfort. In occasions, there might be constraints with manpower, but just ask them. Occasionally can be related to this. But the truth is, because you are being needled, you're having your skin pierced by a big needle. It's not the normal needles, the needles we use to take blood. These needles are bigger, so we can remove a lot of blood to be cleaned by the dialysis machine. But just ask your dialysis nurse about that possibility. You don't need to feel, shy or anything. This is very common. Also, you don't need to bear the pain unassisted. Sometimes it can be done, something about it. So just talk to your team if you're having pain during dialysis, especially during the needling process. In occasions, using a smaller needle is possible and can help, but changing needle size sometimes is difficult because certain sizes of needles are required for different types of access and also for different type of dialysis prescriptions. But you can still ask your nurse and your doctor. Once the needle is in place, typically it's not painful. But if you have any pain, ask your nurse to check the position of the needle, or be sure there is not something else like a bruise that could be actually causing the pain and not necessarily the needle. Keep good communication with your dialysis team whilst the dialysis is ongoing. If we talk about the dialysis process itself, it is typically not painful. So what I mean, how the blood, the dialysis machine cleans the blood is not painful. But certainly, some degrees of pain and discomfort can be experienced by patients. Some patients can feel some aches, for instance, at the back, especially in the first dialysis sessions, when they just started dialysis, while their body is still adjusting to the new therapy. Sometimes it is caused by sitting in those chairs for so long. 4 hours is a lot of time, but it is necessary. There are some more comfortable chairs. It is difficult to change the chairs, but you can bring some pillows, some blankets, to try to your stay at the dialysis center is as comfortable as possible. Or ask the nurses to see if they can, figure out something that they can do for your comfort. Sometimes there can be some discomfort caused by the drastic shifts of fluids and electrolytes during the dialysis process. In addition, some patients can develop painful cramps. This might sound simple, having cramps, but actually they can be very disturbing. And it requires a thorough assessment of the patient's general condition, fluid status, electrolytes, and adequacy of the dialysis prescription. So it requires really that your doctor assess your situation to see if there is anything else can be done to avoid those cramps. Furthermore, some patients can feel a little bit weak or drained during the dialysis session or after the dialysis session, which resolves by itself as time passes by after some rest, and once all the fluid and salt levels inside the body went back to a certain degree of equilibrium post-dialysis. It is important to mention as well that some patients occasionally have heart circulation problems and a weak heart, and they can experience some chest discomfort, palpitations, or even fainting symptoms with or without blood pressure drops during the hemodialysis sessions. This situation must be certainly addressed immediately and addressed by a doctor. Inform your dialysis nurse about this. As I mentioned, all this is very individualized, especially when someone has heart problems or has a lot of disease, etc. So it requires specific medical assessment. I cannot tell you exactly how to sort heart problems because it's something serious. You need to be assessed properly by a doctor. Yeah. In Francisco Clinic Medical Center, we provide empathetic, approachable, and flexible specialist medical and renal care because we can imagine all the struggles, and because we have seen them, that our patients, and not only the patients, the relatives also have. But we try to make all that as comfortable as possible for our patients. I wonder if there is any question. I think there is something on the screen, but it's probably a wave. Yeah, it's a wave. Okay. If you don't have any questions, just now, you can ask them in the replay. If nothing, I am Dr. Francisco, wishing you the best possible health. Take care. Bye.